Hope in small doses.
We will start to deliver those vaccines probably by the end of January, and if not, then certainly by early February and mid-February.
The World Health Organization is starting to roll out over 2 billion doses of COVID-19 vaccines around the world, including the Philippines.
Babakunahan po natin ang humigit kumulang na 50 to 70 million na Pilipino sa loob ng taong ito.
The country is in talks with at least 6 companies to seal the mass vaccination deal, a bid to beat COVID-19, which has started taking on a new face to infect more people.
This will entail really monitoring the behavior of the virus and also monitoring the outcomes among those who have received the vaccine.
Grief, trauma, fatigue, and an unauthorized vaccine use. Our hope to return to normalcy lies in a shot or two. Is this the beginning of the end of the coronavirus pandemic for Filipinos? I'm Hontiveros. We'll be asking the hard questions for stories that matter to you front and center. Hope in small doses, the roadmap to a vaccine rollout across the country to immunize 110 million Filipinos. Local governments stepping up to the plate to vaccinate their constituents as soon as possible. And the COVID-19 vaccine, as explained by a Filipino doctor who received the shots himself in the U.S. state of California. Well, the question on everyone's mind, when will we see the first Filipinos publicly vaccinated against COVID-19? Vaccine Czar Carlito Galvez revealed before senators on Monday that may happen next month. Well, front and center is the Vaccine Czar himself, Carlito Galvez. Secretary Galvez, thank you very much for being with us on the show. Well, let's begin with this. You said at the Senate hearing on Monday that as negotiations were progressing, the pharmaceutical firms were getting generous and that naging at cost, sabi po ninyo. At hindi na sila, ang ibig pong sabihin nito, sir, hindi na po sila kikita or what does that mean?
Alam natin po kasi yung ating mga vaccines ay may mga pinirmahan sila sa mga COVAX facilities, and also the WHO are encouraging them to make it at cost during this pandemic. So marami dun sa mga companies na yun talagang when we are negotiating, talagang binaba nila, binagsak nila yung mga presyo. Unang-una yan, as AstraZeneca, nakita natin na talagang very affordable, kaya yung mga LGU natin talagang nag-aagawan ng vaccine kasi talagang makikita mo na very affordable siya at equitable ang access niya. And then also, we are so happy that yung mga itong portfolio naming nine-negotiate ngayon ay talagang very conclusive na yung ginagawa natin at yung sa indicative price nila napakaganda at ang volumes talagang malalaking volumes ang binigay sa atin. And we are very thankful to them, unang-una sa Pfizer,
Yes.
sa AstraZeneca, yung Moderna, nag-meeting din kami kanina, and very conclusive na rin po ang gagawin natin, and we will announce it later. At yung ibang mga Johnson & Johnson and also other companies na Chinese company and also Gamaleya, maganda po na nakita natin na very indicative na yung pitong portfolio po nito, ito magiging final portfolio po natin.
Ito nga po yung Secretary Galvez, yung isa po na i-present nyo sa Senate hearing. And we wanted to show the slide again just to make it even more visual for people so that they can see kung ano po yung sinasabi ninyo, yung 7 vaccine makers that have made this strong support for a no-profit, no-loss principle, yung equitable access for poorer countries, long-term commitment to end the pandemic. Secretary Galvez, at this point, I wanted to ask you, while we're showing these visuals, is this, I remember very clearly the day the first shot was given in the United Kingdom, the very first country that did the first vaccination, one of their officials said this is the beginning of the end of the pandemic in the United Kingdom. So when the first vaccinations happen here in the Philippines, are you going to be able to say the same thing, that this will be the beginning of the end for the pandemic here in the Philippines?
Ang sasabihin po natin, this is a dose of hope. Meaning a dose of hope na talagang ito ang magiging pangarap natin na makabalik tayo sa ating pinagmulan at ang ating normal situation. Ito rin ang dose na to ang magbibigay sa atin ng katahimikan na hindi na tayo magkakaroon ng tinatawag na crisis on really containing this virus. Pangatlo ay talagang ito na rin ang magbibigay sa atin ng hope na magkaroon tayo ng economic recovery. Alam nyo, maraming stress at saka maraming very social problem at saka economic problem na binigay ng COVID-19 ay napakalaki. At it also some instances nagkakaroon ng tinatawag nating social breakdown, and even yung ating mga kababayan ay talaga nawala ng trabaho. And with this dose of hope, ito yung magsisimula na tayo yung magkaroon ng tinatawag nating katahimikan para at least magkaroon tayo ng kapayapaan na makita natin na yung pupuntahan natin ay makakabalik na tayo sa ating normal na pag.
Okay, well, that's very comforting to hear, a dose of hope. Well, the word hope, it's always very comforting to hear, Secretary Galvez. But also, I remember you were saying in the Senate hearing, and this is something that you've been emphasizing the whole time, and there is a slide in your presentation that you showed the centers on Monday. Yung 20% of the country's population care of the COVAX facility already of the WHO. Is that correct, sir?
Yes, we are appealing. Kanina, kausap na namin yung representative ng Gavi, si Ma'am Alice. At talagang we are appealing na talagang magkaroon tayo ng 20% na talagang free vaccine. Yung 20% po na to ay more or less na 44 doses, more than 40 doses, good for our 20 million people. Ang kagandahan nito ay yung pwede magkaroon ng early rollout. At ang masaya kami, ang i-rollout na dito is yung Pfizer. So we are being evaluated, kung yung eligibility list natin. At we are so happy that nasabi namin that we are prepared for the early rollout, and we will be very happy to really prepare and wait for this moment that makita natin na kapag-rollout na tayo ng mas maaga.
Okay, and of course, another slide that you showed the senators on Monday, Secretary Galvez, which shows the total available funds. We have that, more than 18 million pesos for all these vaccines. Correct, sir?
Yes, actually, kakahapon, nagkaroon kami ng cabinet meeting at tuwang-tuwa ngang ibalita sa amin ni Secretary of Finance, Secretary Dominguez, at saka ni Secretary Absado, na meron tayong standby na 17 billion na pwede namin gamitin. At the same time, meron tayong $1.5 billion or 70 billion na pwedeng gamitin sa multilateral funds. So itong mga pondo na to, kung isa-isahin po natin, ito po yung 70 billion sa multilateral, 2.5 billion sa general occupations, tsaka 10 billion sa Bayanihan Fund. At sinasabi nga po ni Secretary Abisado, meron pang additional 5 billion, kaya naging 17 billion, 0.5 na naging savings na pwede po natin gamitin.
Ang plano po ninyo is 50 to 70 million Filipinos will be vaccinated in 2021. And for 2021, we will have 148 million doses. So may konting sobra din for any eventuality. Is that the plan, sir?
Yes, ang natin, nung una, ang plano natin is 35 million dahil yun po ang nakalaan sa pondo dahil nakita po natin na yung presyo ay nilalagyan po natin ng mas mataas ang presyo. But during negotiation, medyo maganda po ang naging offer ng ating mga manufacturer. Kaya naitaas po natin na from 70 na itaas po natin ng doble. Meaning ang presyo is maganda at naging affordable. So naitaas po na natin 148. As we speak, maganda po ang ating negotiations. Ang binibilang na po namin ay meron na po kaming 145 na volume na pwede namin may sasabi na within 2 weeks time, pwede na natin i-lock in. Sa ngayon, na-lock in na natin yung 30 million na COVAX at na-lock in na rin natin yung 25 million na Sinovac. Ang ating inaabangan yung sa Pfizer, lumaki din po ang volume at yung J&J, inintay na lang po namin yung final conclusion ng aming term sheet. At ang lahat po, pati po yung Gamaleya, naging positive po, inaangat po nga nila na pwede pong magbigay sila ng 50 to 100 million doses. So nakita natin na napakaganda ng mga diplomatic relationship ito, lalo na sa ating mahal na Pangulo, dahil napakaganda ng diplomatic relationship ng ating mahal na Pangulo sa lahat ng mga bansa na pinagmulan po ito.
Yeah. Of course, Secretary Galvez, in any plan that you make, and this is to wrap up the interview already, there are always challenges. For example, yung nangyaring early vaccination sa PSG. Pangalawa, isa lang po yun. Pangalawa, yung the issue of vaccine confidence, and that's why you need to generate the demand for the vaccine. Pangatlo, marami pang ibang mga challenges, na para bang ang nangyayari po kasi sa atin, we are learning from the countries that have been able to do the initial vaccination. So, can you discuss that for us, sir? How are we going to surmount these obstacles? Not obstacles, challenges.
Nakita natin yung mga challenges na nangyari sa Amerika nung nag-deploy sila ng Moderna at saka yung Pfizer. And also in Europe, especially UK, EU at saka itong Germany, nakita natin may mga tinatawag nating mga challenges. At the same time, tinignan din po natin yung magagandang practices ng Israel at saka ng India. And we saw that kailangan talaga na close at integrated ang ating tinatawag nating command and control at saka yung tinatawag coordination natin sa LGU. Napaka-importante yung coordination natin sa LGU kasi nakita natin ang LGU talaga ang mag-implement ng immunization program. Nakita natin yung mga pagkukulang doon sa ibang bansa. Nakita natin walang close coordination or close contact doon sa mga tinatawag natin from federal state to the different national government. So ngayon, ang sinisimulan natin ngayon, yung mga ospital, ngayon as we speak, pinakausap na po ni Yusik Kabatahe ang mga ospital para at least yung ating mga medical professionals ay magkaroon na po tayo ng mobilization. So ito po tinatawag nating whole of government approach. So yung mga challenges ng cold chain, nakausap na po natin ng private sector. And as we speak, talagang ang capability natin, yung Pfizer at saka Moderna, yan po i-deploy natin po sa mga highly urbanized center. And then yung AstraZeneca, Novavax, J&J, at ang ibang Sinovac, i-deploy po natin to sa mga power plant area. So maganda po yung strategy natin, geographical at saka sectoral. At alam po natin kung saan natin i-dispose or i-apply yung mga tinatawag natin mga vaccines.
Okay. So, Secretary Galvez, finally, what you're saying is in this whole-of-nation approach, walang may iwan, walang iwanan. This is a vow you are making as the Vaccine Czar, and you are echoing the call of the President, we are not safe until everyone is safe. Sir?
Yes, ano pong gagawin po natin? Talagang whole-of-nation, whole-of-government approach at tinitingnan po natin, ginagawa nga po natin kaya nagkaroon tayo ng tripartite agreement with the LGU at saka po sa private sector para alam po natin, alam po ng Pangulo na kakayanin po nito pagka nagsama-sama po tayo. Ang sinasabi nga natin na pagka tayo nagsama-sama ay magagawa po natin itong lahat at wala pong mission impossible when we are joining this together.
Mission possible, in other words. Thank you very much, sir, for joining us on the show, Vaccine Czar, General Carlito Galvez, Secretary Carlito Galvez. Salamat po, sir. The stories that matter are front and center. Local governments in and out of Metro Manila prepping their own vaccination drives, and they want it done in no time. Also, how do COVID-19 shots feel like? We'll find out from a Filipino doctor all the way from the U.S. state of California. Stay with us as we pin our hopes on these small doses to end the pandemic. We keep the stories that matter front and center. I'm Hontiveros. Welcome back to the program. Our hope to end COVID-19 lies in small doses of vaccines, which local governments across the country are buying in bulk. After setting aside millions of pesos in funds, over a dozen cities managed to seal a deal with vaccine manufacturer AstraZeneca, one of the front runners in the global vaccine race. Now, one of these cities is San Juan in Metro Manila, a priority area for COVID-19 vaccination. Front and center now is San Juan City Mayor Francis Zamora. Mayor Zamora, thank you very much for being with us on the show. Well, let's begin with this. To get this deal with AstraZeneca, 50 million pesos worth, what did you have to go through to get this?
First of all, good day, Pia, and to everyone watching CNN. Can I share that it was a very, very simple process? Actually, one thing that I appreciate with AstraZeneca is that they never made things complicated. In fact, it all started with an initial discussion, and then a non-disclosure agreement was sent to us. We signed it immediately, and just after a few days, the formal contract was signed electronically, and then that's it. And I realized during our Metro Manila Council meeting last Sunday that most other mayors signed the same contract. So I believe that the majority of the Metro Manila mayors have signed contracts with AstraZeneca. Personally, I chose to sign with AstraZeneca because one, I believe it is a very reputable pharmaceutical company. Even before COVID, we have heard of AstraZeneca. Also, in a practical sense, the pricing is within range. It is affordable. It will not require any complication in terms of storage. And also, the manner by which their country manager deals with local governments makes it very easy for us. So, looking at everything, I'm very happy that we eventually signed with them, and we're just waiting for the arrival of these vaccines.
Mm-hmm. Okay, pricing, Mayor Zamora, are you at liberty to talk about the pricing?
Actually, I cannot disclose the price because we signed a non-disclosure agreement. However, I can share with you that we procured 100,000 doses, which is enough for 50,000 residents. We have 122,000 population based on the 2015 census. And you may ask why procure only 50,000. It is because the national government has also promised an allocation for our city. So we do not want to over-order at this point. We allocated 50 million pesos, and our initial order with AstraZeneca will leave us with still a significant amount. Wherein we can always have a second order with AstraZeneca, or we can eventually contract another pharmaceutical company. So 50,000 constituents at this point is already a very big number considering our very small population in San Juan.
On Monday, during the Senate hearing, Secretary Carlito Calves was saying that they were surprised because during the negotiation, as the negotiations progressed, with the different pharma firms, naging at cost. It was getting to be very easy to talk to the pharma firms, and hindi masyadong pricey yung mga vaccines. But well, like you said, you're not at liberty to talk about the price. But Mayor Zamora, I wanted to move on and ask you about when are we going to see the first vaccinations in San Juan? Is it going to be next month already, February or March? Do you have a timetable for that?
Okay, no specific timetable has been given to us. In fact, even the other mayors mentioned that they still do not have any specific timetable. But what is important really now is the groundwork. What I mean by groundwork, we've already launched our online registration, and the same with our manual registration in the barangay halls and health centers. Because while waiting for the vaccine, what is important is we really get a concrete number as to how many of our constituents want to be vaccinated, what are their ages, where do they live, so that we can prepare logistically for the eventual inoculation of our constituents. So if it does come sometime April, May, or June, that would be enough time for us to prepare everything so that once it is indeed here, all we have to do is vaccinate our people.
Yeah, you said online registration, similar to Manila, and I'm sure many other cities are going to do the same thing. So if this is 100,000 doses for 50,000 people, how many people, how many residents of San Juan have signed up for this?
Okay, we started our online registration January 4, and as of today, we have about 9,000 registrants already. And I believe this number will increase further because we just announced formally our contract with AstraZeneca 2 days ago. So at first, people were really asking what kind of vaccine we will be procuring here in San Juan. And after signing last Sunday, we formally announced it to the public already. And I believe that this will be a major factor in increasing the number because one common question really from our people is, ano bang brand ng gagamitin natin sa San Juan. So there's also a big consideration dito sa amin, no? Because one factor really is the trust level of people. If people trust the brand, if
Right.
people trust the vaccine, oftentimes they would really signify their intention to get vaccinated. So that is a challenge
Okay,
for
yeah,
us
many
to
issues
make
there.
people really
Yeah.
confident about the vaccination process. Of course, giving them a brand that is internationally recognized, one that is reputable, increases the trust level of our people.
Well, thank you very much for your time, San Juan City Mayor Francis Zamora. The stories that matter are front and center. No better way to find out how a COVID-19 vaccine looks like and feels like other than from someone who got it. Front and center next is a Filipino doctor from the U.S. state of California who just about 8 hours ago got his second shot. Keep it here on CNN Philippines. Welcome back to Front and Center. We want answers to the stories that matter to you. I'm Pia Hontiveros. Experts are learning more about the COVID-19 vaccines as rollouts and trials continue around the world. Now, that happens as countries battle a second or a third wave of outbreaks, just like in the United States, specifically in California, one of the hot spots there. But front and center now is a Filipino doctor vaccinated against the coronavirus from Fremont in Northern California. Dr. Benito Valencia, a doctor of internal medicine from the Washington Hospital. Dr. Valencia, Benitz, I hope you don't mind me calling you Benitz, my college batchmate. Thank you very much for agreeing to this interview. Let's begin with this. It's just been about 8 hours, Benitz, no, Dr. Benitz, since your second dose or your second shot. How are you feeling right now? And when was the first one?
I'm feeling quite good. It's like I didn't get a shot at all. I usually don't have much of a reaction, so I'd say it's been like a flu shot. I got my first shot of the Pfizer vaccine December 21st, and got the second shot 3 weeks after, just about almost 9 hours ago.
Okay, so December 21st, the first shot. After that, you were fine also. Walang problema, in other words.
Walang problema. I was actually quite worried if I was going to be sick during Christmas, but didn't really feel anything at all. I've had some patients who had very minor reactions, but nothing to be really concerned with. Mild local muscle soreness, maybe some fatigue, maybe some fever, but very, very little.
Yeah, which is usually the case. I remember, Benitz, when we were kids, no, when we'd have vaccinations in school, we'd always get that soreness, no, the muscle soreness around the area kung saan na-vaccinate tayo, or, the slight fever. It wasn't something we really welcomed, except that we did welcome that we could skip classes, right? But these are normal reactions, like you were saying, minor reactions.
Yes, they are. In fact, some of the experts would say that it's probably proof or supportive of the fact that the vaccine is doing something for you. Because after all, what you're trying to do with vaccination is inciting an immune response from your body by introducing it to something of the virus. And so you would expect to have some muscle pain and some fever.
Okay, that's very important to remember, like you said. And that is something I remember that the doctors used to tell us when we were kids. So, pag may reaction, it's working. Also, another thing I'd like to ask you about, you said you got the Pfizer vaccine, no? And this is because this is what is available in the U.S., correct?
Yes, right now, the two vaccines that are available to us are either the Pfizer vaccine or the Moderna vaccine. In the UK, they have the AstraZeneca, but I haven't seen that introduced in the US so far.
Okay. And I asked you that question because here in the Philippines, there's a lot of fuss today about the issue of choosing the vaccines, no? Because the spokesman of the president yesterday was saying na hindi pwedeng maging choosy, no? We cannot choose the vaccines that we will be getting because it depends on what gets to your city or your town. And hindi natin pwedeng sabihin kung anong brand, no? Does it really matter, Dr. Benitez, Dr. Valencia, does it really matter what brand of vaccine we use? Now, the other portion of the question here is really about, in a way, it's become a political question, no? Because critics of the president are pointing out that why can the president choose what vaccine he uses? Because his spokesman says, ang gusto niya, Russian or Chinese vaccine, and then ordinary citizens can't. But does it really matter?
I guess the first consideration would be availability. Like, I don't have a choice of any other vaccine because what's available to us is the Moderna and the Pfizer vaccine. There are some differences between the vaccines, but they're relatively minor. As you know, the Pfizer COVID vaccine was considered about 95% effective, and the Moderna vaccine is considered about 94.5% effective. The AstraZeneca is quoted as anywhere from 60 to 70% effective against COVID-19. The other differences are whether it's going to be available and practical for you. As you know, the most impractical would be Pfizer because it needs to be held in such a low temperature that even in the US, there are some rural areas that you can't really get the Pfizer vaccine because you need special freezers. I believe it needs to be kept at minus 90 degrees Fahrenheit, which is about minus 70 degrees Celsius. That's very cold, and not even industrial refrigerators would be able to carry that. It's a little bit better with Moderna. The draw for the AstraZeneca vaccine is that it doesn't need that specialized freezer. You would probably think that in any particular situation, wherever you are, it depends what infrastructure is available.
You are not invincible. No one is. Everyone is mortal. No, so the health protocols continue, right? Even if you've had the vaccine already. And then we're going to just very briefly na lang po because we're going to end the interview already.
Right. The vaccination is just one weapon against the virus. It doesn't rule out social distancing at least 6 feet. It doesn't rule out wearing masks, which are very effective against spreading the disease. And it doesn't rule out washing your hands at least 20 minutes.
All right. Dr. Benitez Valencia, all the way from Fremont, California. Thank you so much for your very wise words. The doctor's orders we should all follow. Salamat, Benitez. It is the mission of the century, vaccinate every person to knock out COVID-19. Hope is very much alive with vaccines now at hand, but so near, yet so far. Plans are in place, but we may have to wait a little longer to get that much-awaited shot or shots for a better normal. And as we wait, we seek the truth and demand answers for questions that hang in the air. The accountability over doses that came in secretly right into the seat of power. How the COVID-19 shots will reach the hinterlands and the poorest of the poor living on less than $1 a day. How to convince a population that's doubting science. The urgency to inject hope in an ailing world is growing by the day. But we do have to cling on to hope that these small doses bring to get through this pandemic. This is Front and Center. I'm Hontiveros. Thanks for joining us.